Here we've been raising awareness on maternal health and mental wellness, especially among Black women.
Studies show that Black women are 3 to 4 times more likely to die during childbirth due to related complications. A few weeks ago, I talked with doctors from Raising Resilience Counseling, some therapists, about addressing specific needs of Black women and the fight to provide a safe space.
We were just privy to all this information about maternal mental health conditions, the prevalence, especially for Black women, how often Black women experience these perinatal mood and anxiety disorders, but they're also least likely to receive support. And so it just really hit home for us in personal experiences and the work that we were already doing.
Well, there are bills in the North Carolina House and Senate to give grants to organizations offering maternal health care services with an emphasis on improving access for Black women.
Joining us this morning to take a closer look at Black maternal health are doctors Tiffany Bates and Nicole Parson from FemWell Gynecology. Good morning, doctors. Thanks so much for getting up to join us.
Good morning.
Good morning. So let's talk about the factors that contribute to the higher than normal rates, or higher than average, I should say, of maternal mortality when it's compared to Black women compared to others in the U.S.
Yeah, so I think that health inequity and a lack of access to high quality medical care lead to a lot of these rates that we see. I think also the pre-existing medical conditions, high blood pressure, diabetes, obesity, can also lead to this. There's also some implicit bias that we see with the providers that are providing care to these women. I think all of these things combined lead to the rates of higher mortality and morbidity in Black women in this country.
And do you know of any community-led programs and initiatives that have proven effective in sort of tackling this issue?
Yes, I think the Black Mamas Matter Alliance has made a big impact when it comes to advancing Black maternal mortality and morbidity and just rights and justice, as well as initiatives like the North Carolina Maternal Innovative Program, which is now handing out, I gave birth bracelets, and this is allowing us to really know that a woman recently delivered and focus on her postpartum care and support a little better. I think having access to community-based doula programs is very important. I think women tend to feel more heard, like they have an advocate when they're going through the labor and delivery process and even postpartum period. And then things like Mind, Body, Baby here in the Charlotte area, it's a great support system. There are wonderful apps, the Earth app, Her Health and Her Hue is another app that I can think of that's made a big difference.
We hear the words access and advocacy a lot when we talk about getting health care and resources to those who need it, and really for everyone. I remember studying this when I was in grad school, actually, and this does not cross or it goes across all socioeconomic barriers, race, class. I mean, for Black women, it doesn't matter. Serena Williams, the great tennis legend, talked about experiencing problems when she was pregnant with her first child. Talk about how that affects sort of the care and the role when we talk about access and then advocating for yourself.
Well, I think that everyone needs basic access to good, high quality care in this country, and not every woman gets that. And so I think we have to start there to make sure that we have access for all women to high quality care. And then I think that as you talk about Serena Williams and any woman in this country, that they should get unbiased care, so that we can make sure that when we are being cared for by our physicians, that we get this unbiased care, that we get timely interventions, that we are seen and heard, so that when we are getting that care, that we feel comfortable and confident that the interventions that we're getting, that we are getting that care, that we are not getting delayed treatment in our pain, delayed treatment in our blood pressures, and in other conditions that can lead to those higher rates of morbidity and mortality.
I think you say bias there, and I think people, that often comes with a malicious intent, and sometimes that's not the case. But I know even, as a gay man, I go to a gay male doctor because he's more aware of the issues facing the gay community,
right.
And the same goes for other communities as well.
Absolutely. I think it's important to have access to medical staff and healthcare providers that understand where you're coming from, maybe look like you. Oftentimes that's very, very helpful.
So is there anything that you think or you would say to the people who are watching, not just Black women, but watching this to improve these maternal outcomes?
Yes, again, I think having access to a diverse medical staff, really being diligent in doing your research on your provider before you decide to, go receive care from them so that you can feel comfortable communicating your needs, knowing that you'll be seen and heard. Considering hiring a doula or, entering one of these community-based doula programs. I think if we also improve the social determinants of health, like improving poverty rates, addressing our housing instability, that has a direct impact on maternal morbidity and mortality as well.
And then I think also building that relationship. I think that a lot of times it's just having a good relationship with your physician outside of the pregnancy. Don't wait until you're pregnant to have that relationship. That it's not always like as you said, an intentional bias there. That if you have a physician that may or may not look like you, but you have that relationship and you've built that trust and you have that open communication, then you're able to have that base relationship there so that when you are pregnant, you have that open communication. And I think that those outcomes are better. And then also making sure that your overall health and wellness is a priority so that when you are pregnant, you come into that pregnancy at a better state of health to improve the outcome during the pregnancy.
And I should say, I've talked to Congresswoman Alma Adams a number of times about this, and she has been one of the biggest advocates and biggest champions for this cause on Capitol Hill in D.C., pushing for more funding from a federal level and beyond.
For sure, and I think she said it right with open communication because, everyone wants to be heard, especially when you're talking with your doctor. You need that relationship there. Doctors Tiffany Bates and Nicole Parson from FemWell, thank you so much for speaking with us this morning. We appreciate your time.
Thank you.